Good afternoon. I'm David Baiada, the CEO here at Bayada Home Healthcare, and today is Tuesday, March 24th. This is our first daily broadcast to all 30,000 field office and support staff at Bayada across 24 states and 8 international countries. I decided to address you directly today, and I'll do it each day at 4 p.m. until further notice, because I feel that it's critical we all come together as a community to navigate this crisis together. I know many of you are confused, scared, anxious, and tired, and I share all of those feelings. And I want to openly share facts about this pandemic, about what we're doing as a community, as a company, to keep you safe, to keep our clients safe, and to be a part of the solution as a home care provider and as a community of compassionate caregivers. Before I start, I want to share that I care about you. I care deeply about each and every one of you. I care about your safety. I care about supporting you in a time of incredible stress. I care about what's happening with your families and the stress that you're navigating at home and its impact on your ability to focus on your work and taking care of others. And it's that care and compassion that I think characterizes who we are as a company, who I am as a person, and what we're doing to ensure that we navigate all the choices necessary to keep you safe and to keep our clients safe. So a few basic facts. The number of cases of positive COVID-19 patients in the United States is growing. I mean, it is escalating every hour of every day. And we do have a small group of both employees and patients who have tested positive or are in quarantine, waiting for test results because of exposure. And when I lay awake at night, there's definitely some sleepless nights over the past week or two, and I think about how are we going to navigate this challenge. I keep coming back to the Bayada way. I look to the Bayada way to calm me, to give me a sense of clarity about what's important, and it really starts with our mission. Bayada has a special purpose. We want to help people have a safe home life with comfort, independence, and dignity. You make no mistake, Bayada will continue to answer the call of duty, to show up every day, to take care of the most vulnerable at home. Because in our beliefs, the first belief is that our clients come first. We're already taking care of COVID-19 positive patients that are being discharged from our hospital partners. And we're doing everything possible to have the supplies, protocol, training, and everything necessary to take care of our existing clients safely as well. We will not back down from this virus. And we're going to do everything we possibly can because of our second belief that our employees are our greatest resource to support you in answering the calling, rising to the occasion to take care of our clients, help them continue to remain safe. Because we know that you're a home health professional. You chose this work because you want to help others, and we want to help you do that. There are a few critical issues that I know are on the minds of many of you that I want to address in this first broadcast. The first is related to personal protective equipment and supplies. Most of you that I talk to are itching to get out there into the community to take care of your clients, but you're depending on equipment to keep you safe in answering that calling. I can tell you I and many, many others are working 24/7 to source equipment and supplies from all over the world, masks, gowns, everything necessary to ensure your safety and our clients' safety. This is one of the hardest problems I've ever experienced. It's literally changing every hour of every day. I'm talking to manufacturers and factory owners and hospital CEOs. We're setting up distribution centers around the country of our own so that we can pack our employees' cars with goggles and gloves and masks so that they can deliver them to you out in the community. This is really hard. And particularly for those of you that need equipment in order to be able to get out there and take care of people. And so I'm asking a few things. Number one is be patient and be understanding. We're working so hard to get you what you need. Number two is to conserve. Be mindful of the protocol and the guidelines that dictate which types of supplies are needed in which situation, because there are patients around the country that need them most. And so we need to funnel the supplies to the right place at the right time. And so talking to your clinical manager and your director about which type of supplies are needed for your clients at any given time is really important. And that's changing every day. We're funneling supplies from parts of the country that don't need them as much to the places like New York that need them desperately to ensure the safety of our clients and employees. Thank you for your understanding, your patience. Please know that we're working so hard to ensure we have the equipment necessary to keep people safe. Number two, I'm definitely deeply concerned about those of you that have been exposed to the virus or potentially exposed to the virus while at work, taking care of your clients. It's really a scary time. You're facing lost income. And particularly in the absence of testing, it's even scarier and more frustrating. And so we've created a compassionate leave program and contributed $1 million of company funds, as well as over $300,000 of employee donated vacation time to fund the relief and sick pay for those employees that have been exposed to the virus at work. We're also doing our first nationwide fundraising campaign to contribute to this relief, as well as to fund potential opportunities like childcare and financial assistance for employees that have been exposed at work. And lastly, we are introducing, for those of you that are spiritual, a daily prayer. It'll be by phone, open to all employees and clients, and led by one of our BAYADA chaplains. Please stay tuned for more information about this important ritual. People often ask me, what can I do to help? How can I get into the mix? How can I be a part of the solution? How can I be a part of a team in a community that's rising to the occasion to ensure we keep our clients safe? Here's a few things I think are really important for you to think about. Number one, be safe. It's really critical that you stay healthy, that your family stays healthy so that you can stay healthy, so that you can keep your clients healthy. The risk of you getting infected by the virus is probably greater at your kitchen table with your kids than it is in the homes of your clients. So be mindful of that. You have to behave and ensure your family and those around you behave as if you're already infected. It's critical to follow the basics because that's how you're going to stay healthy and be available to take care of our clients. Number two, be trained. Understand the guidelines, our protocol. It's changing a lot. Every day we're redesigning policies and processes and reissuing new guidelines based on a better understanding of what's happening, a better understanding of the way the virus is spreading, and how we can best support you in the field. It's important that you stay tuned into those guidelines, that you work with your clinical manager to understand to make sure you're up to speed. Number two, be patient. Number three, be patient. We're doing our best to get you the supplies you need, and we're working really, really hard to do it. So thanks for your patience. Be hopeful. I feel an incredible sense of hope. I see and feel hope in others. Every single day I talk to dozens, if not hundreds of people in all different forms, video, phone, to figure out how can we help you. And I feel this incredible optimism, this sense of teamwork and hope that we're going to navigate this together. Thank you for your hope and optimism. Lastly, be caring. Care for yourself. Care for your personal health. Get rest. Eat well. Focus on your personal, mental, and physical health because you need to be at your best in order to be able to take care of our clients. So in closing, I just want to reiterate this deep sense of caring, compassion, and gratitude. I know that you are navigating an incredible amount of stress. You're working really hard. There's a lot of uncertainty, ambiguity, tension, anxiety, and I feel a sense of gratitude. I feel a sense of connectedness, even through a camera, to each and every one of you, because together, we're putting our values at the center of our work. We're recommitting to purpose every single day and helping each other make sure that our clients can remain safe and independent at home. Be safe and Godspeed.